to the discussion that's taking place. I would like to welcome guests or to this adult social care and health. As in all our meetings, I think it's only appropriate for us to start with the 72 those who lost their lives in the Grenfell Tower fire. So please, Yasmin, can we start now, please?
Yep, I'll start now.
Thank you.
"72 seconds has ended, Chair."
Thank you, Yasmin. At the outset, I would ask that members of the committee only unmute their microphones when they are addressing the meeting. Likewise, to save one bandwidth, I would ask that councillors only switch on the cameras when speaking and remember to switch. If a councillor wishes to speak on a particular item and has not been called to speak, please indicate by typing the letter Q in the conversation column by using the hand up features or by drawing my attention and just drawing my attention up. Please do not use the conversation comments as they can be seen by all participants and they are retained. To assist your fellow councillors, officers and members of the public who are watching online to identify you, please state your name before you speak. If for your connection drops out or you miss something, please can you let us know? And the event that my connection drops, I nominate Vice Chancellor, Councillor Max Shaw, to take over the meeting until I sort out my problem. I confirm that I have no declaration of interest to make regarding any items on this agenda. I will now turn to my committee members.
Chair, it's Yasmin. Can I suggest that you turn off your camera?
Present, please.
To help with your connection.
Yes, Yasmin. I do apologize. Yeah. I confirm that I have. Is it better now, Yasmin? Hello? Yasmin?
Yeah, that is better.
Okay, I will turn off my camera now. I don't know why I switched it on. If for any reason I will nominate Councillor Max Johan to take over the meeting. I confirm that I have no declaration of interest to make regarding any items on the agenda. I will now turn to my committee. Could also let us know if you have any declaration to make after introducing yourself. Now I call my fellow members. Councillor Max Johan.
Thank you. Here, present.
Councillor Ola Idris.
Yes, Chair. I'm present and I have nothing to declare. Thank you.
Thank you. Councillor Laura Round. Councillor Malcolm Spalding.
Present, Chairman, and I have no declaration of interest.
Thank you. Councillor Portia Thaxter. Councillor Charles Williams.
Present, Chairman, and I have no interest to declare.
And we have our co-opted non-voting member, Christine Vigars, with us, I hope. Yasmin?
No, I'm afraid we don't.
Okay.
Just to confirm, Chair, I have no apologies for absence.
Okay, thank you very much. I have received just a quick message from Councillor Thaxter. She will join us a little bit later. The next item on the agenda are the minutes, but given that we have external speakers here tonight, I will take them at the end of the meeting. And may I proceed now to the discussion of the safeguarding report, which is item A4. The welfare of all adults, particularly those vulnerable or at risk of harm or neglect, in the borough is a top priority for the council, and more so this year when vulnerable adults have been subject to unique pressures associated with the impact of the health crisis and the pandemics we are facing, and specifically related to care home settings, but also impacting on the protection and safeguarding of all vulnerable adults during this critical time. We will be scrutinizing the Safeguarding Adults Executive Board annual, which provides an overview of the work this multi-agency board has taken during the year 2019-2020. The board is independently chaired by Eileen Buck to cover both Royal Borough of Kensington, Chelsea, and the City of Westminster. To assist us and advise in this task, we have Jane Humphreys with us. Jane was corporate director of both adult services and children's services at Stockton-on-Tees Borough Council for 7 years. She has also previously managed health services in a joint role and has chaired adult safeguarding boards. Jane currently works for the Local Government Association, assisting and advising local authorities on safeguarding matters. She is here with us to advise committee members, but will not be taking questions to the officers. If members agree, I will take the report as read. I understand that Eileen Buckton, who is the independent Safeguarding Executive Board, and Louise Butler, interim heads of Safeguarding Workforce Development by Borough, will be answering our question. Welcome, Eileen and Louise. I will take questions to Eileen and Louise from members of the committee first, followed by councillors and members of the public. So may I now invite questions from my committee members, and if possible, if Eileen and Louise would like to introduce themselves briefly, I would really appreciate it. Thank you. Before taking the questions, just introduce yourself briefly.
Thank you, Chair. Should I start? My name's Aileen
yes,
Buckton.
Please, Eileen.
Yes, my name's Aileen Buckton. Good evening, everybody. I am the independent chair for the Borough Safeguarding Adults Executive Board, and I'm very pleased to be here with you this evening. as the chair explained, the annual report is the report from 2019 running up to March 2020. And I'm joined by other officers tonight to be able to answer, hopefully, your questions and to discuss with you the content of the report.
Thank you, Eileen, for this brief introduction. Louise, you would like to speak?
Just very briefly to say that
Yes.
my name is Louise Butler and I'm the Interim Head of Adult Safeguarding and Workforce Development across the Borough. Thank you.
Thank you very much, and welcome. Nice to have you with us tonight. So may I see now, just double check. I have, before I go to the officer, I think I have one officer hands up. Yes, Visva? Yes, Aviza? Can you?
Thank you, Chair. Thank you, Chair. I would like to sort of introduce the report. Firstly, I would like to thank Aileen Buckton, the MBE, and our chair of the independent board, and to produce a full and detailed report for the scrutiny and for the board. And this year, the government guidance that LSAB boards are not required to produce a full report, but she managed to get this produced in a timely manner and able to present to the scrutiny this year. And the annual report provides an overview of the work of the board and it's sort of, and also its subgroup. So it's not the board of the council, it is the board of the multi-agency partnership. And it highlights various work streams and progress we have made last year on our business plan. And Aileen touched on the time it covers the report. So it's from April 2019 to March 2019. So this report will cover the beginning of the pandemic, but not the middle of the pandemic. So and the report has the work, the Safeguarding Adults Partnership done with the partners during the time of the first lockdown, I guess, that time. So the next report will be detailed about the COVID. So thank you, Chair, for the opportunity. I'm going to hand over to Aileen to present the report.
Yeah, thank you very much, Visva. It's very clear. And yeah, it's ended up in March 2020, which is just at the border of this pandemic. And of course, this has been taken into consideration. But thank you very much for the appreciate. Can we go to the questions regarding the report, if you don't mind, now? So we have Councillor. We'll start with Councillor Williams. I think, Visva, you don't want to ask any more follow-up. So can you just touch the hands down, please?
Right. Yes, thank you very much. Thank you for providing me with additional information. I'm sorry, I'm going to start by saying I think this should have been in the report. And I would ask the board to think very carefully about what it puts in its report. And I think we need to have more figures and also explanation of things like what Section 42 is. But I was going to ask really about Section 42 firstly. And I mean, how confident are you that you are, that your first stage, where around half the concerns raised were not proceeded with? How confident are you that you have a robust procedure? Because obviously we can't look as a committee at individual cases, but you can. And I'd just like to be given more reassurance on that.
Yes, certainly. I'll take this question. Thank you for that, Councillor. And certainly any comments that that you wish to make about what would be useful to be in next year's report, I will take that to the board. So that that'd be very helpful, because we do really try to want the report to be accessible and for people to be able to pick out from it things that are kind of relevant to their particular situation. And it is something that has a sort of wide remit. So, and we have got some jargon busters at the end of the report, but it may be that we still are not managing to nail all of the kind of jargon. So thank you for that. And I will make sure that I'll take that back to the board. To answer your question, Councillor, about the Section 42 referrals, that the balance of just under or around 50% not going forward is what I would expect to see, and it's very much in line with the figures that you had, the data you had for the previous year, and very much in line with other London authorities. What we're trying to achieve is to encourage as many people as possible, and that is officers from the statutory agencies in the main, and you'll see from the report that they do most of the referring, but not just them. People who work in other public sector or even private organisations. We have had some referrals, for example, from banks, and we've had some referrals from housing associations, from a whole range of partners from the voluntary sector as well. That what we want to achieve is that everybody who is involved in working with local communities, that they see safeguarding as being their business. So if they see something or hear something that doesn't seem right and seems that somebody might be being subjected to some kind of harm or abuse, we would want to err on getting as many referrals as possible. Now, we do a lot of training with public sector staff and with voluntary sector organisations to get appropriate referrals. And by and large, they are. Sometimes people don't know enough about the kind of details of a situation to know whether it might need to be taken further. But we would want, on balance, people to make referrals. So I personally don't worry that quite a few of them don't go forward to a full kind of safeguard inquiry. We would always make sure that they are referred to the most appropriate place. And sometimes that might be a complaints process, or it might be an assessment for another service. So we would make sure that people's referrals were dealt with appropriately. And then for those that do go through, that we give as much training as we possibly can to those making the referrals, so they can be as full as they can in the referral that they make. But sometimes that, they just don't have all the information, so they don't know whether it's going to be taken forward. And as you will see from the report, you have in Kensington, Chelsea, about 15 referrals a week, and that, as talking to other safeguarding chairs across London, and in terms of what happened the previous year as well, that balance feels right to me. And we do deep dive checks. So there is a subgroup who looks at all the referrals. And I get regular reports from them, and so do the board, so that I am assured that the process is robust and it is working well, and that the right referrals get through for further investigation, and sometimes end up, not that often, but sometimes do end up in a full Safeguarding Adults review, that is known as a SAR. So I do feel able to give you that reassurance.
Okay, thank you.
Thank you, Eileen. That's very nice. Councillors, I will take a few questions if you don't mind. So I will take Councillor Spalding first, then Councillor Chauhan, then Christine Vickers. Councillor Spalding, please.
Thank you, Chairman. I've got two questions. One of them is very complex, I'm afraid, and the other was very, very simple. So if I do the complex one first.
Yes, please.
The Safeguarding Board says its vision is that communities will have the right to live a life free from harm. And of course, the work that the board does in the care setting, the residential care setting, is wonderful. And we're so grateful for that. and they're to be praised, and I think it's a very valuable service. However, in this borough, 50% of the households are single person households. 40% of the whole borough is single of pension age and above. And so you'll notice that on page 21, it says that of your referrals, 74.1% are incidents of safeguarding that take place in the home. And of course, those are single people mostly. Now, that's sometimes picked up through care workers and so on, and social workers. But what worries me is, for instance, in my ward in Earls Court, I've got lots and lots of supported social housing, and I'm getting all sorts of inappropriate placements into that unsupported setting, which is causing disturbance to vulnerable single residents. And the point is, on page 36 of your report, you have identified point 4, who is our community? What voices do we not hear? Now, I wonder what mechanism you have for communicating with, for instance, my community in Earls Court, and how you get hold of people who are vulnerable and are at risk of abuse through all sorts of disturbing placements into what you might call common register housing, which are not appropriate. I just wonder, have you got scope to get better at your communications with the supported communities, the single persons in their own homes, and with communities within the wards? A lot of your report refers to Westminster. I don't see a lot of work communicating with RBKC communities. That's my question.
Thank you for that, Councillor. I'm going to start, and then I'm going to ask Louise to.
Eileen, sorry, Eileen, can we take 2 further questions?
Oh yes, I'm so sorry, Chair. I'm so sorry.
If you don't mind, then.
Well, my second question, Chairman, is a very simple one, and that is, on page 37, we have a list of who the board, who the board actually, well, who they represent, but we don't see who they actually are. And so my question is, who are the local councillors from this borough who are on the board? And what percentage of these people on the board actually live in RBKC? This is to do with community communications and community representation.
Thank you, Councillor Spalding. Now, Councillor Chauhan, please. And then Christine. Councillor Chauhan, please go ahead.
Hello. Can you hear me?
Yes. Yep.
Wonderful. I was just going to pick up on what Councillor Williams was talking about earlier, asking about earlier on, picking up on the data and numbers for reassurance, and more specifically on leading and listening and learning with care. Now, on page 24 of the report, it mentions work has been done to undertake and address the outstanding assessments. Is the deprivation of liberty safeguards team currently up to date with all the DOLS referrals? That's my question.
Thank you, Councillor. And finally, Christine, please.
Hello. I also have 2 questions. The first one relates to this report on the section on making safeguarding personal, page 17. I'd really like to know a little bit more about the way in which outcomes are evaluated. It looks from the bar chart here as if most people are very satisfied, but on the other hand, I don't know what they're satisfied about, because the idea of outcomes can be interpreted in all sorts of different ways. And I just think that the evaluation of outcomes is such an important area that I'd like more information on it. So that's the one question. The other one is around the future, really, because you say that safeguarding referrals fell off in March and then picked up again in April. And I'm wondering just broadly what has happened since then, and also whether in your objectives for this year, which are listed at the back, whether there will be any alteration to those, or looking at the stress that has been caused through COVID, which one would expect would lead to more safeguarding referrals. And in particular, I suppose, looking at the stresses that we have been picking up, that has been particularly evident in the Black, Asian and minority ethnic communities. And I'm wondering whether you are planning to have any analysis of that looking forwards.
Thank you very much. Eileen, over to you or to your committee members to address. Thank
you, Chair.
Thank you.
So if I start with the question that the councillor raised in relation to supported living and people on their own in isolation, living on their own, I think it is a particular feature in Kensington and Chelsea, actually, that you have a higher percentage of safeguarding referrals that come from people living in the community, as opposed to those who might be living in residential or nursing home care. It's higher than the London average. And it's something on the board that we're very aware of. And one of the things that's very important to me is that our referrals and our contacts and the networks that we build need to be much wider than those who just work within the social care and health sphere. And so housing officers, community groups, volunteers, of whom we've seen increasing numbers during the COVID period, but I think in Kensington and Chelsea it's always been a sort of community that's very well developed, that we use those networks to get feedback. We have kind of the local account group, and we have a reference group for those people who have experienced safeguarding experiences themselves, to help us with this and to work with other voluntary sector organisations so that we have a kind of reference back to those people who have been through the circumstances of needing to be safeguarded, that they kind of help us to build those networks to make sure we get referrals from as wide a group of people as possible, and that we actually do outreach work. And part of our work is, so for example, the local account group and some community representatives made it, and this is very much prevalent in Kensington and Chelsea, made some videos to share with community groups and faith groups about scams and financial abuse, which, if you look at the stats in the report, is one of the most common things that those living on their own feel that they are being subjected to. So all the time we are trying to build an awareness of what safeguarding is, working through the networks that are there in local communities for us to build on, and very much working not just through the offices of the council, but a wider range of partners to do that. And certainly those in supported housing, in kind of hospital accommodation, if there are difficulties that were being kind of talked about, and in the first instance, that would be about raising those difficulties with the services that are making placements and the services that are running those services. But if out of that there are safeguarding concerns, then we would want those to come through the safeguarding process. So it's very important that we build those real strong networks. I think there may be only a small section in the report that talks about the work that's being done in Kensington and Chelsea, but I think there is a huge amount about the community level work actually it's been enormously influential, because we have very strong links into the voluntary sector, and they're very much kind of involved in wanting to do safeguarding training and wanting to make sure that they do joint work with kind of members, across the safeguarding partnership board, and that works extremely well in the borough. And when it came to March and we were faced with the COVID situation, there was such strength and such a foundation of working with those voluntary sector organisations that they were able to step up to the plate. And as many more new volunteers came along, we were able to offer them safeguarding training. We've been able to offer help with kind of DBS checks, all the things that you'd want to have kind of in place quickly, as we did in March. So I think that is an enormous strength. But I'm going to ask Louise, who's been very involved in this work, whether you'd like to add to that, Louise?
Thank you. And I think that Councillor Spalding, that's an excellent question. And what I'd like to say is, right at the very beginning of the COVID pandemic, back in February, I think it was, one of your the CEO of the KNC Volunteer Centre, Michael Ash, made contact with Ailey and myself. And indeed, at the same time, your Director of Communities, Tunde Oleinka, and said, can you please support our communities now in RBKC to support the most vulnerable members of the communities who you probably don't even know that they're out there yet. And we have done a huge amount of work, which we're continuing to do throughout this year with Michael Ash, the CEO, with Age UK, and most importantly, with some of your more diverse communities, such as ADKC, the disabilities communities, and Jamie Renton. So I would say that we have a excellent. It could be better, and indeed I think that it's a very valid question talking about Earls Court and the issues that you described in Earls Court, but we are really striving to get out into the hidden communities, getting out into the faith-based communities, getting out into the ethnic communities, which we haven't prior to the pandemic really had access to. So however dreadful the pandemic is, it has actually shone a light and opened a door for us, which we have stepped into. And we hope that in next year's report, we'll be able to show you some of the very good work that has taken place.
And if we move on to talk about the makeup of the board, the cabinet member for adult social care and health is a member of the board, and we are in regular contact with elected members locally who do make kind of safeguard referrals into the board. The board itself has 3 statutory members. So that's the local authority, who are the lead for the safeguarding board, but also the CCG and the police. But we have a much wider membership than that. And certainly Louise can say something about the details that you wanted to know about the membership. We have a wider membership, and we actually try to make sure that as many partners who are delivering services where safeguarding referrals come from are represented on that board. But it only works if the board itself is in contact with representatives from local communities, and in particular the section that you mentioned about finding the voices that don't get heard is the work that I've been talking about, and that Louise has just given more detail on, because the work that we do in terms of outreach and prevention widens, if you like, the kind of remit that the board's able to take on. But I don't know, Louise, do you want to say any more about the makeup of the board? So in particular, our community engagement group, and indeed our developing best practice group, and our better outcomes group, they're all actually chaired not by the local authority at all, but by our partners. So if I come to the community engagement group, which is the one that has done a huge amount of work during this pandemic, it is actually chaired by one of the key engagement officers from the Advocacy Project.
I also know that on this call today we've got Olivia Clymer from Health Watch. She's a very active member of that group as well as one of the directors of one of the housing associations, who I believe does actually have housing in the Earls Court area, and that's Notting Hill Genesis and also Octavia. And they are instrumental and responsible for getting their feelers out, right out into the communities. And because we've had such a great amount of support through Michael Ash and the Volunteer Centre, and indeed also to your Older People's Forum, Zara Goads, they are exceptionally, we have a huge amount of gratitude for them in order for us to actually get out to hear the voices of those people whom we haven't in the past heard. There's still more work to do in this area, but as I said before, we are really making great strides just at the moment on the back of the pandemic. Thank you.
Thank you, Chairman, for that.
Thank you very much.
Thank you.
Yes, Malcolm, do you want to follow up? No? Okay.
Yes. Okay,
may I take
Just to say thank you. Thank you, Chairman.
All right. So,
just
okay, thanks.
So just on to the question about deprivation of liberty. Yes, we can say that the assessments have continued to be up to date. I think this is a really good news story. It was very, it was a kind of common practice across London when there were enormous amount of kind of assessments that needed to be made in relation to deprivation of liberty, that a number of authorities held kind of waiting lists. But this authority undertook a review of the Safeguarding Board, not this year, in the kind of previous year. And my understanding is one of the recommendations from that peer review was that it would be good to tackle the waiting list of deprivation of liberty assessments that were outstanding, because they were being reviewed and making sure that they were prioritised, but they felt a recommendation was to tackle the list. And that's absolutely what happened in relation to the team. They did tackle that list, and now both boroughs, actually, both Kensington, Chelsea and Westminster, are in the kind of upper quartile for performance in relation to deprivation of liberty. So I think it is a really good news story, and it's one that's been maintained, even though that has been much more difficult during the COVID period. So I'm very grateful to the officers for having done that work. Is there anything else that you would like to know about deprivation of liberty, or anything, Louise, that you wanted to add?
No, but as long as it's clear that we absolutely have got rid of the backlog, there is no waiting list, and I'm very proud of the team to have achieved this work, particularly during this COVID times.
Thank you. That's a very encouraging conclusion there, dealing with this issue despite the pandemic, which is a very big challenge. And this, as you told us, this is going to be a reassurance in the next report in dealing with the these complicated issues being surfaced post-COVID. Councillor Idris.
Thank you, Chair. I have a couple of questions. One, are all your studies based on referrals, or do you have other means of contacting and dealing with cases? And my second question is, I looked at the demographics of the people being used in your stats. I didn't see anything about male domestic abuse, because men do get abused quite a bit domestically, but then it's a very sensitive topic, and sometimes when a woman talks to her neighbor about her problems, it's not as easy for men. So I wonder, how do you tackle that, and how do you study it? Thank you.
So, Chair, should I just go back? Also, there was another outstanding question. Should I just deal with that first?
Yes, please.
Yeah. Certainly, yes. So just to focus on for a minute the making safeguarding personal and the outcomes in relation to that. I mean, it is certainly the case that that we do offer training. We actually give quite a lot of thought to helping staff to work with people who either have been subjected to abuse and neglect or with their families about what outcomes they are seeking. And it is important for us to record those well at the beginning of the safeguarding referral. And how we then evaluate whether it's been successful is to go back when the safeguarding inquiry is completed and then talk to the person themselves or with their families about whether they felt that those outcomes were met. And if it's not possible for whatever reason, then to be clear and transparent about what those reasons are. And it's on that kind of process that we base that assessment. And I think we are doing well there. I think that the level of those that are met or kind of partially met is high. But for me, it is always about that one always wants to kind of strive to do better and better in terms of being able to meet the outcomes, because part of the process of not only feeling that we have learnt from the safeguarding process, but for the person who has been involved in it, to work with them for how they feel about it and how they are able to deal with it afterwards. I think that outcome process and identifying outcomes is an important part. So it is a very important, and we do take it very seriously indeed. And one of the things that we certainly could do moving forward is to be able to share, I think, perhaps some of the stories. Sometimes we find that that is a useful way, that when you can't get at data in quite that way to get the feel of it, we might be able to share some stories about service users who were able to kind of share how they felt their outcomes have been met. We certainly will. There was also within that as well about would we be looking more in terms of ethnicity data? This is the first time in the report that we've included ethnicity data, and we are in the process of collecting that data from the partnership as a whole. I think we've got a long way to go to break it down further and to understand what it means, but we are very committed indeed to doing that, and that's why I wanted it in the report this time. And I think the last part of that question was about future work. And the point about doing the annual report really is it helps to set the agenda for the coming year. And normally that's a relatively straightforward process because you learn so much from what's gone on in the year and what needs to be continued and what new issues have come up. But none of us could have envisaged the year that we were going to go into. And I did hold a meeting both at the beginning of the COVID period to seek assurance, with the board, from providers about what was happening during COVID and what were the new issues that we needed to respond to. And we had another session over the summer, and we're going to have another one in February, so that I want the board to feel they've got a full picture of what went well, what didn't go so well, what were the safeguarding issues that came up, and make sure that we do respond to them. So we will be.
I've lost contact, or
can you not hear me?
I can hear you.
We can hear you.
Yes, we can hear you.
Sorry, should I just, yes, okay, I'll just finish that little bit off. So the answer is yes, absolutely. We have made changes for the work programme this year and responded to what has been taking place, as well as taking forward the learning from last year. I've made sure in terms of the board meetings that we have got time for a kind of reflection, because I think there is a lot to be learned that then we take forward again in terms of what have been some of the kind of safeguarding issues, because life has changed in terms of how we work with people and respond to the referrals. And then just moving on then in terms of referrals, the work that we do doesn't just come from safeguarding referrals. We do have a responsibility, as I've mentioned, in terms of preventative work. And so we do actually get feedback on what we think some of the kind of current concerns are, and try to do some proactive work to prevent abuse, obviously, and neglect from taking place. So some of that is very much kind of upfront programs of work, and some of the work that you see in the report reflects that. So some of our learning comes from referrals, but some of it also comes from what people in communities are talking about that are of concern to them. I mean, organisations such as Healthwatch are so important actually in highlighting those things for us. So we're able to respond in a more general way rather than just through referrals themselves. Louise, do you want to pick up the question about domestic abuse?
Yes, of course. I think that's an excellent question that's been asked about male on male domestic abuse. So we have a joint working agreement with the Violence and Women and Girls Group, which is led on by RBKC Community Protection. And that's one of the very first things that not only we, but also the communities wanted to have, is assurance that even though it's got women and girls in the title, that it is actually gendered, so that the fact that people from all different walks of life, whether they're from the LGBTQ community or whether in fact it is male on male domestic abuse, that we are seeing that they are addressed. And it is a minority of the abuses which we come across, but we are assured that through the domestic abuse networks that it is addressed, and they do in fact have a solely male domestic abuse IDVAs, who are independent domestic abuse advocates. And so we are assured that male on male abuses are addressed specific to the needs of that client group.
Oh, thank you very much.
I think thank you very much. I think most of all the questions I think being answered to a good standard, and I know there are many challenges I can see which you are going to take into account moving forward for the future program. Councillor Thaxter, please ask your question.
Well, thank you, Chair. I think one of the officers covered most of it, actually, but there's something I wanted to ask. I'm taking into consideration the importance of safeguarding. I mean, how long is your training and how often do you review these sort of training? And do you really go into this sort of safeguarding in depth where people understand? And how would you identify if someone doesn't understand? Is it computerized or is it face-to-face training?
Thank you. That's a very key question for us, actually, about training. I mean, the answer in terms of how the training is delivered is it's mixed. There is some that is done online, and obviously over the past few months we've had to do a lot of, do all of our training online. And actually we've had some very good feedback from it, and I think we have improved the way in which we're able to kind of engage and do training online. We've got much better at that, it seems to me, since March. It's one of the things that I want to hold on to. But once we're able to, I would also want to go back to face-to-face when that's appropriate. So we use different ways. And I mean, as I was saying before, the service users have made videos, which also kind of raise awareness about safeguarding, which they share with community organisations. So it's a kind of wide range of, that we use in terms of trying to get the message across. The level of training depends on the level at which kind of officers are working within organisations. So obviously there's kind of training for frontline staff across the board, across all sort of public sector organisations and voluntary sector organisations, and that will be fundamentally about how to how to recognise a safeguarding alert. It's having a curiosity, I guess, is the word, and I think having a sense of there's something not quite right here. You know, there's that I have now kind of, you know, thinking about what to look for, what to listen for, and then once you've picked up, I think there's something I need to explore more. I'm just going to ask one or two more questions, then knowing where to go with that information. So that level of training we try to make available as widely as possible, and it's continuous because obviously staff come and go, and people are working in community organisations change, and we want it to be a kind of continuous thing. So that part is very much bread and butter of the board's work, and we try to record the training that's undertaken, and that forms part of our work to evaluate that. We also obviously have training that's far more in depth for officers who are doing safeguarding investigations, or for people working in a kind of wide variety of organisations, of how they might need to be involved in taking something a step further, of how they work with people who've been subjected to neglect, and what are some of the kind of ways of doing that, of actually making people feel safe to be able to share what's happened with them, of people working in ways that encourage kind of safeguarding to be open and transparent and not something that's not talked about or happens behind closed doors. So there's a whole kind of variety of training programs that take place. And as I say, with very different kind of levels. And we ask each member organisation of the board to report annually on their training programme and to give us the evidence of who's completed it and the level they've completed it and how they know, and they have to give us examples, how do they know that actually people understand it and that it's embedded in people, in what people are doing, and that people are thinking about it. So we ask them to do an evaluation and feed that back to us. So I think it was a very good question about how do you know that people understand it. Don't know, Louise, if you've got anything to add to that.
Well, I was going to add exactly that point, Aileen. So what we've started to do, and admittedly it's been in the last year, after the training has taken place, about 2 months later, members of my team call up 3 or 4 people who've attended the safeguarding training, whatever it might be, and they actually ask them various questions. And essentially what we're trying to tease out is how they've actually used the training from theory and how they've actually embedded it into their practice. So we actually ask them pertinent questions. Now, I literally today, I was hearing about some of the answers which we got. So I was really pleased, and this is something that we're going to continue to do actually across all of our training. So I think that's all I just wanted to say, is what we do in the local authority around evaluating the training and how we know we're making a difference.
Thank you. I think that's covered and under what I call heading quality level of approach, especially if you have any system in order to ensure quality being addressed. You have to recognize the input, what process, and the output, and how you put the whole things into tuning and alignment. I would like actually to ask a question myself, based on how you are embedding and providing this kind of training. So what I would like to ask the board, how confident are you, especially in the model, the Think Family model, which I was interested in to read in details on page 28 for the on the reference on your document. How do you see this Think Family approach is embedded in the adult frontline staff and their managers? Because I can see that you recognize the on page 29, the challenges facing the frontline being in tune with that approach, and that's it's not really still not feeling confident. How do you address that?
So Louise, do you want to talk about the? Yeah, do you want to talk about the programme? I mean, but it is absolutely right that we have recognised it as a priority, and we have started some work with officers in children's services and with the Children's Board. so that we're doing this as a joint piece of work. And we've had some initial sessions, but we still think that there's quite a way to go. But I don't know, Louise, do you just want to say a little bit more about that?
Well, just a small amount, because you're absolutely right. There's more work in progress here. We are working closely with children and families around addressing not only the transitions client group, which is the client group that ages from 16 to 25, to make sure we have a better understanding about how we can support those young people as they come out of children's services and move into adults, or indeed don't move into adults at all, actually, and drop through the net, and we're there to make sure they don't do that. But going back to your question about Think Family, so we've done a survey on it and we were surprised by the results. We have more work to do. I can't assure you just at the moment that it is being used. All I can say is the fact that when we actually when I start to attend meetings myself and bring it up, people do know what we mean. So we think that sometimes people are using a Think Family approach, but they talk about it in a different way. They use a different language. So there is more work here to do, and what we've demonstrated in the board is really what we would like to achieve as an outcome. And next year's report will have a much clearer evaluation and evidence of what's actually happening on the ground.
Thank you for your honest answer, and I can recognize it will be nice just to highlight it there. That's still work in progress. Otherwise, it is recognized, but there is no that didn't come through. That's you are addressing it. Yeah, thank you for shedding light on that, which is quite encouraging, especially the young adults you are highlighting, the 16 to 25. I think this is a very critical age group. Coming from 16, going ahead along that line. So I'm glad that's in your survey that you are having this awareness. That's what the model you're trying to create and explain. It's not what's being perceived. So yeah, thank you very much for that clarification. Councillor Idris, you still have your hand up. Do you want to have a follow-up question?
Oh no, sorry, I'm not.
Okay, no, great, that's great. Now I have Councillor Shohan, then Councillor Healy, please. Councillor Shohan.
Can you see me? Okay, great. Just your question, Councillor Mullen. This was about the confidence of the board. How confident is the board that learning from safeguarding adult reviews and the Think Family approach is embedded in frontline staff and frontline practice? That's my question.
Well, I think the learning from safeguarding reviews happens in two ways, really. One is that having a safeguarding review for the board isn't something that happens all the time. Some years you don't have any safeguarding adult reviews, and sometimes you might have 2 or 3, but it's not huge numbers. So part of the learning that we do comes from other people's safeguarding reviews. And we've done quite a lot of work as a board in relation to what have been some of the key themes that have happened, that are commonplace throughout safeguarding reviews. So quite a lot of the learning that we try to disseminate and get down to the front line is also from other reviews, as well as from those that have taken place in the borough. The Think Family did come from a case in the borough, which is outlined in the report. And as we've said, we think that is still work in progress. But we do feel that the other learning from that SAR is very much embedded, and that we've had some examples, and there is one in the report of staff in our, a partner organisation looking at some of the difficulties that staff had in raising when they felt they'd been talking to someone who was aggressive to them, or that made it very kind of difficult to carry out their role, that it was quite difficult sometimes to feed that up, because of their sense, oh, I must just go out and try again, and just constantly taking on the responsibility for feeling that they couldn't overcome the difficulty. And so we've done lots of work with partner organisations about how to make sure that staff feel able to raise kind of difficulties when they feel that they're being harassed or being subjected to abusive behaviour themselves. And that's kind of highlighted in the report. And we've had sessions where staff have come back and talked about how useful the training has been and what they've learned from it, and how they now feel. And that's what we feel is really important. There's no point just looking at a SAR and saying, well, this is the learning, and then delivering the training, and then you don't know whether it's really landed and whether it's really making a difference in terms of people's practice. So we go back and ask for, where's the evidence that people are actually working kind of differently? And I think that you will see in that learning section that we feel that some of the learning from that SAR is very much embedded. And I think the Think family, we're beginning to get there, but it's still work in progress, as we say.
So more of an update on that next.
Thank you.
Thank you.
Thank you. That's really acknowledged and clearly explained, I believe. Thank you. Councillor Healy, please.
Thank you, Chair. May I say at the outset, I think this is a very positive and comprehensive report, and I'm well aware that the emphasis is about finding ways of doing things rather than apportioning blame. However, previous annual reports have given both the numbers of referrals that have taken place and some information about the outcomes. And one of the recent outcomes has been that a large number of the accused of abusing in one way or another older people have turned out to be staff, and some of them have lost their jobs. I wonder if it's possible, given that there are 15 cases a week, just over half of which do go forward, what the outcomes are in terms of who has been found to have been carrying out the abuse and what has happened to them.
Well, the board doesn't keep kind of data of that kind in terms of the reports that would come to the board. But what's very important in terms of the safeguarding process is to ensure that if there are investigations that have to happen about staff in any organisation, that we make sure that's kind of dealt with appropriately and obviously dealt with by the employer. The role of the board is very much to look at the learning that comes from those safeguarding reviews and how you embed that learning. But it is, we do make sure that appropriate referrals are made, and obviously employers are then have to kind of undertake their investigations. And sometimes, of course, those investigations might be criminal investigations. I mean, it can be all manner of investigation, but the safeguarding review itself, as you say, is not about apportioning blame. It's about the learning that has taken place. So we don't have that kind of data in the report, but I think that what we could do to assure you is that, and I think it is something that we can't put every example into the report, but we do have examples, and we will share examples of what's good practice in terms of how referrals are made and how they're looked at. And we do that through, we have a group that looks all the time at safeguarding reviews and practice. And so we can draw out some good practice examples from that for you.
Fine, thank you.
Thank you. That's very interesting. That's you are going to present like a process model for referral in a visual.
We can certainly do that, and that's something that doesn't have to just be in an annual report. I mean, we do have, in fact, we have been working on making sure that our safeguarding processes are right in terms of reviews, and that we use the most appropriate review for the circumstances that we're looking at. And we have been writing that up, and that's a report to the board, and the reports are available, and we can make those available.
Thank you very much, Eileen, for this reassurance. It's quite interesting. Any other councillors to ask a question because I like to come to a conclusion here. If there is no more question from the public, if there is no councillors, I can't see any hands up. So can I, have you received any written questions so far? Yasmin?
No, Chair, we don't have any questions from the public.
Okay, then I think just been left to me here now to thank Louise and Eileen for this quite honest discussion. I hope you've taken on board our views and the councillors' view. And hopefully we look forward to receive your next year report in a context of COVID. Hopefully it will be behind us, but with the vaccine hopefully in the horizon, and people behavior hopefully will change as well to accommodate that will be no more cases. May I thank you again for being with us tonight, presenting this report to our committee. So thank you very much, and you are welcome to continue with us, and I'm really grateful.
Thank you very much, Chair, and thank you very much for all your questions this evening. Thank you.
Thank you for accommodating us in a very difficult time. And now I would like to call, although it's not an agenda on the item, however, it complements. So may I extend my apology to the lead member. Just an insertion of Councillor Kamali, please do bear with me. Good evening. I can see you straight coming to box in there. It's nice to see you. I would like just to have with permission, just a brief introduction complementing what we've been discussing tonight from Olivia Clymer, who is the Chief Executive Officer of Health Watch, to give us just a verbal reflection on the related items. So hopefully this will be very brief, and good evening, Olivia, for joining us. That's very kind, and the floor is yours.
Thank you, Chair, and I will be very brief. I think it's it reflects well on our by-borough that Health Watch is so sort of front and centre, and our independence is welcomed. I think this is really well reflected in the Safeguarding Board. Our dignity champions work to contribute when we do visits into the care homes. We pick up on different agendas and different items that are welcomed, and that soft intelligence is often used and drawn upon. So we appreciate that opportunity. I'd like to also compliment the board that there's definitely been a shift to being more open to the community, helping community organisations to participate, to bring concerns and to raise safeguarding concerns, which hasn't always been the case. It has been in the past a difficult channel to reach. So that's much to be many thanks on that. But also I think that drawing upon Health Watch and that independent space is to be commended. We sit on the community group, and there was an excellent event for Safeguarding Week coordinated through that group, and again thanks to Jamie Renton on that one as well, and the data that we see through the Better Outcomes group. So I think from Health Watch's point of view, there's some good connections, good drawing upon evidence and data. So I think we're heading in good directions, and we welcome the opportunity of working with the board. And they have in fact commissioned us through this year to give some independent review of the sort of front door of safeguarding, which will be coming to the board in due course. So that's just to give you that sort of independent comment from your Health Watch. Thank you, Chair.
Thank you so much, Olivia. That's very kind of you to project your independent observation. I think this will shed some quality work on our scrutiny, and I welcome your contribution tonight, and always you are in our thoughts for all the excellent work you are doing for our community. And this will make me move to the item A5 on the agenda. And this is coming from lead member update on local COVID-19 response. This update set out the current arrangements for supporting residents during the COVID-19 pandemic and the initial work undertaken to support recovery. If members agree, I will take the update report as read. I understand that we have the lead member, Councillor Jem Kamali, for the adult social care and health, and Russell Stiles, I believe, from the Baybara Deputy Director for Public Health. They will be here answering questions. I will leave it to Councillor Kamali and Russell Stiles if they want us to have an overall view, or we can go to questions as you see fit. I'm happy with both. So,
thank you, Chair. I would like to just start firstly by thanking you and your committee members for writing to the Royal Brompton Hospital recently. We were unsuccessful. We both tried our best, but I do really look forward to making sure that any services at the Royal Brompton going forward are both scrutinised from this committee, but also from the executive of the council as well. I think it's in all of our interests. So I just want to extend the thanks to yourselves and to your committee, and also to previous members of your committee who I know also have an incredible interest in the hospital.
Thank you, Councillor Kamali. Appreciate it.
Absolutely, not at all.
And may I add as well the excellent work they are doing during this pandemic, the Royal Brompton. I add your compliment there.
Absolutely. And Chair, as you'll see, as with everything to do with COVID, by the time the reports are written, they're already out of date, unfortunately. Obviously, there has been further updates on our case rate. London has, of course, gone into Tier 3. We have also expanded our community testing, so we've moved forward on that one. And we've also, been testing within schools as well. So I'm happy to answer anything, but I think it's fair to say that the report is slightly out of date now, unfortunately, as with all of these things. So I'm happy to take questions. Really, it's up to you. It's your committee.
Thank you very much. No, it's absolutely, you are right. The events are moving very fast. Overnight now, we are into Tier 3, raising complication, adding more stress. And it will be nice as well to see how responsive, how resilient our processes are in place. What I've just read your email on the update and further things, actions being taken, which I would like to share it with the committee later. But this will show that's how responsive we are as a council, which is I'm pleased with that. So I will try to open it first to committee members, if you don't mind. So I will start with Councillor Williams, Councillor Sexter, and Councillor Spalding, and Christine. And then we'll take 4 questions now.
Yes, thank you very much. Could you please explain a bit more about the community testing strategy? I understand this is with, correct me if I'm wrong, this is with the lateral flow test, which produces, it is reported, a significant proportion of false negatives. So, I mean, it could give you false reassurance. I can see that it has a role, say in Liverpool, where you try to test the whole community, but we don't have the resources to do that. So what exactly is the strategy?
Thank you, Councillor Williams. Next, can we take 4 questions, Councillor Kamali? Okay.
Thank you,
Next.
Chair.
Okay.
Yes, Chair. I would like to know, in the COVID update, how many of these people tested positive are from the BAME background? And also, we know that COVID-19 has exposed underlying health inequalities. Health death rate of London with disproportionate impact on Black communities. And what systems have we got in place to support these people, these residents, moving forward?
Thank you. Next question, please.
Thank you, Chairman. two quick questions for Councillor Kamali. Okay, we're in tier 3. There is an argument that says there should be more granularity and differentiation in this tiering. Is there a process for that? I mean, why can't we be in tier 2? We're well under the London average and way below the national average. Are we going to go and ask, is there a process that we can trigger to ask the Secretary of State that can we be in tier 2, please? Second question, the reply that Councillor Kamali got from Sally Morgan, the chair of Royal Brompton Trust, third paragraph of the letter that you shared with us. Third paragraph says, we've completed a full 8-week formal consultation with our 4,000 members of staff. And it says they are increasingly keen to proceed. Can we ask them for some figures on that and ask them why they haven't consulted the patients and our residents? Those are my two questions. Thanks.
Thank you, Councillor Spalding. I think if we can, I want to stay clear at the moment from Royal Brompton for any question from the committee or from us to follow up on that. I would like to have it separately. But I will leave it to Councillor Kamali if he wants briefly to answer that question. Christine, please.
Yes, can I ask questions about vaccination?
Yes, please.
Can you update us on what is happening, has happened or is going to happen about vaccinating residents and staff in care homes and nursing homes? And do we have any idea about how many of those staff are likely to refuse the vaccination, and then what is the strategy on that if they do? And then secondly, we know that there is a lot of fake news and a lot of disinclination to take up the offer of vaccination. And can you update us a little bit on what is being done by the health champions and others to counter that?
I think there is a section being addressed in the lead on communication 2.3, but we'll leave it to Councillor Kamali. Can I take one question from Councillor Chouhan and then to you, Councillor Kamali, to answer, please? Councillor Chouhan.
Oh, hello. Yes, it's a brief question on test and trace. In the report, it says that the council has set up local contact tracing scheme to supplement that of the NHS national test and trace programme. I was just wondering, how is the data fed into the national test and trace programme, given that I myself have experienced that there's a double kind of contact from the local authority and the national test and trace, and the individuals may receive 2 calls, or there may be some confusion. I just want to know how that information is fed into the national test and trace service. Thank you.
Thank you. I think that's I've seen it myself, and I was just trying to see the process there. Yes, Councillor Kamali.
Thank you, and thank you all committee members for your questions. I'll answer them in order. Councillor Williams, obviously you'll have seen that we are starting public testing at the Great Hall in Kensington. This is really the first public testing that we've been doing. We have been doing some testing of schools and of council staff as well, just to make sure that our testing processes are suitable and adequate. We will be rolling this out to other areas within the borough. There is now communications on the council website that we will be having testing in the Venture Centre up in North Kensington. We will have the Kensington Leisure Centre as well. And in the next short time, we will also have Chelsea Town Hall as well as a centre for testing. Your point on false negatives is of course valid, and we can't say for certain that every test done is absolutely correct. And when you receive your results, it does come with that caveat attached. This is absolutely not about giving people an immunity or a passport to go and do things. It's really just to try and break the chain of infection. And whilst false negatives are of course not ideal, we wouldn't have, if we weren't testing, you wouldn't have known anyway in any case. So if we are picking up some positives, it's better than not picking them up at all. And the benefit of it is that they are quite accurate with the positive cases. And then we do recommend immediately that you have a PCR test to verify the lateral flow. But what at least this does do is it gives residents the opportunity to get themselves tested quite frequently. The intention is to test 10% of the borough every week, which is obviously a huge endeavour. And in all likelihood, some people will come forward multiple times, and that will be their prerogative. But we do really want to make sure we're testing as many people as possible, not just the same people over and over again. As part of that, we will obviously be working with the DfE to test in schools when they reopen in January. We were testing there in schools today, and we're also, as you mentioned, the strategy. Part of the strategy is to actually train other people to do the testing, as we can't physically be everywhere at once. But what we can do is train teachers, we can train staff, we can train business places as well, or the cultural sector, and then they will be able to do their own testing, and the council will act more as a supervisory role and sort of the logistics arm of getting the tests to the people carrying them out, whilst of course maintaining our ongoing testing facility across the borough. I hope that's answered that, but happy to take more. To answer Councillor Thaxter's points, I'll defer to Russell on the actual statistics. To my knowledge, I don't believe we're given the exact information of the people being positive, but I'm happy to be proven wrong if that's the case. But what we have noticed is, we've seen some recent upticks in the number of cases in a few of our wards in the north of the borough. And so what we are doing is obviously having the Venture Centre, the Kensington Leisure Centre, and we will also be working to have mobile testing units slightly more flexible so that we can respond to any upticks in cases. But by having two permanent centres, we hope we'll be able to encourage people to come forward to be tested. We will also be working with the Henry Dickens Centre as well to try and make sure that they're carrying out lots of testing. We'll be working to try and get Portobello traders and Portobello visitors tested as well. So I don't know if, Chair, you want Russell to answer the bit about the demographics themselves, or if you want me to just continue. Shall we ask Russell in now?
No, I think it's very important. Yes, please bring Russell in at this point. It will be appropriate, if possible. Yeah.
Hi there. Russell the voice hasn't got higher. This is Natalia Clifford, Deputy Director of Public Health. Russell sends us a
Hi, good evening, Natalia. Yes.
Hi, how are you? So question specifically about the reliability of the LFT testing. And I can comment on the rest of the questions as well.
I think it was demographic, Natalia, on the BAME communities in North Kensington.
Yes, sure. Thank you so much. So we're not able to access that data at that granular level, but we are very much aware and learning from the national data and the regional data, which tells us very clearly that there is a disproportionality in confirmed testing, in confirmed COVID cases, but also in take-up of testing. So rather than, so we're absolutely moving on that. And just to say, as a result, we are focusing on the annual public health report this year, which will be due the end of March, is on the disproportionality of COVID. And the underpinning of that is the health impact assessment, which is due before that, hopefully in February. In order to kind of address these issues, we're not waiting for that report in order to act. So we've also targeting and tailoring and enhancing our resource in terms of NHS health checks. So really working to enhance our support within our BAME communities. So does that helpful in terms of that question?
Yes, but we need the reassurance that this data will be pursued because we've seen so many practitioners from the Bain communities who lost their lives, isn't it?
Yes.
For COVID. And this will show some responsibility from us as a council in public health, that we are pursuing this to have a full picture of what's going on. So yes, please.
It'll be there. It'll be in the health impact assessment and the annual public health report.
Excellent. Thank you, Natalia. Yes, Councillor Kamali, do you want to?
Thank you, and thank you, Natalia, and for stepping in for Russell tonight. So on to the question about tiering and the granularity for Councillor Spalding. It's my understanding, Councillor Spalding, that London decided to move as one. All the MPs and all the councils agreed that it was sensible for London to operate as a single entity, as I believe there are issues of trying to figure out exactly how you would draw the lines across the city. And we're also able to offer mutual aid to one another by operating in this way. And I know we are helping with officers in northeast London, where there are very high cases, in much the same way we would expect aid to come to us if our cases were to rise so greatly. The point on the Royal Brompton, very quickly, obviously they did mention that they've consulted their staff. I believe only 3% of their staff are Kensington and Chelsea residents. And I think the point we both made, both as a committee and as the executive, was that we do expect them to consult fully with our residents and our businesses and all of our local institutions if they do plan on moving services. And then, of course, if they do plan on moving the site or selling the site itself, we would expect proper consultation, and I'm sure we will all hold them to account on that one. As to the vaccination, again, this is I think we should firstly applaud the fact that we are one of the very first nations in the world to be conducting vaccinations. It seemed a long time ago where we were all waiting, pleading for a vaccine to exist, and it is now here. As I understand it, we will be in wave 3, which will commence on the 21st of December. This will be the first vaccines will be in Earl's Court for the 21st, assuming deliveries are made on time. And then there'll be further deliveries for wave 4, which would be the 28th of December for both St. Charles and also the Violet Melchett Centre. These are, I should caveat and stress that the plans do change daily, I'm afraid. So, I would hope, I will of course let you know if anything changes again, but the intention is that 80% of the vaccines would be used for the resident community over 80 years old, with 20% of the vaccines going towards healthcare workers and the NHS. That's obviously good for our local residents, but also good to make sure that our key workers are getting vaccinated as well, as they come into contact with so many of our residents and nearby boroughs. As to how we're tackling sort of the anti-vax movement, you'll have seen in the report that we have our community champions. You'll all know them well. And part of our community engagement is really just trying to make sure that all of our local representatives, councillors, local business owners, everybody in the community, faith groups, all of those are fully aware of, firstly, how safe it is to be vaccinated, but also how important it is, because it will only be through a large percentage of the population receiving the vaccine that we're able to actually stamp this out and really bring the numbers down. So I would urge all of you to make sure you are feeding into your local communities. I'm sure you are already, but when it's your turn, please do get the vaccine, and let's try and put a stop to all of this. As to test and trace, I think it's a success story from Kensington and Chelsea. We've been able on some days to be able to add about 10-11% additional contact tracing above and beyond the NHS main system. That's giving us on most days quite close to 90% contact. We do have officers that are door knocking within the borough, offering residents the support, pointing out the payments that they may be entitled to, the options for how to get through self-isolation and what they must do to make sure that they are engaging with with people in our community rather than simply somebody on the phone. As to the actual specifics of how we receive our data, again, I'll defer to Natalia here, but it was my understanding that we only receive the information if NHS have been unsuccessful in contacting them. I'm not sure about the issue, Councillor Chowan, about how the data is then fed back. So perhaps Natalia could give the specifics on that one. Thank you.
Yeah, hi there. Thanks so much for that. Yes, so when you become a local contacting tracing borough, you sign up to a whole lot of data sharing agreements with NHS Test and Trace, and you have access to their portal, and we have to upload our data to Test and Trace. So there's a kind of whole system. So we're not functioning outside of the system, if that makes sense.
Yes.
Yeah, and there is a 24-hour, it was a 48-hour window when the NHS Test and Trace system tried to contact that confirmed case. And after 48 hours, they would refer to the local contact tracing. And I believe that's now been reduced to 24 hours to try and reduce that. There are loads of issues with contacting cases. Wrong digits are given, you can imagine, and the rest. And so locally, what's helpful is we can use our local data sharing agreements to, for example, look at council type records and get addresses and knock on doors and things like that. Hence why we get that uplift. Just to say as well, I think it's also a good news story that we were able to share across London our rates, and we're really up there with some of the best in terms of uplifting into contacted confirmed cases. So that's really good. Just to say, this is confirmed cases. That's it.
Okay, thank you, Natalia. Councillor Chauhan, do you want to follow up? No.
No, I think that was thank you. That was a comprehensive response, and it's good that the hours have been reduced from 48 to 24, because there was a certain degree of confusion amongst people that were being contacted about local authorities and also the national test and trace program contacting the same individual. It's been happening quite a lot, and I think there's lots of little issues like that are being ironed out. And making iterative changes of improvement. But thanks very much, Natalia.
Yeah, I agree with you, especially this one will raise a concern for trust, because it's better to come from a single source, which is the NHS. And definitely, I agree with you, Natalia. That's to have quality data being uploaded and cross-referenced is very important for trust to remain there and to remain high, especially in terms of vaccination and conspiracy. This is has to be really digested with yourself and in the public health to ensure that the message is very clear, crystal clear. They try to iron out any ambiguity in that approach. That's why during this time, the communication is paramount importance. And I hope, and I'm sure Councillor Kamali as well will agree with me on that. Any other members would like to ask a question or seek any clarification?
Chairman.
Councillor.
Yes, I just wanted to ask Councillor Kamali if he could give an update on how the home care service is performing at the present time with all the challenges that COVID presents for it.
Thank you.
Thank you, Councillor Williams. I had asked officers to put together some figures on this one, and I'm hopeful that Chanel perhaps would be the right person to provide those tonight.
And they will share it with us. It doesn't have to be now.
No, yeah.
Because it will be nice to have a quality, up-to-date figure, Councillor Kamali, and then we can share it with us.
Absolutely. Thank you. I'll get. Oh, I see Gareth has raised his hands. Perhaps he has the answer.
Yes, Gareth. No, Sanel, it looks like it. No.
Thanks, Councillor. No, sorry, it's Gareth, the Director of Integrated Commissioning. Just as a quick figure, and just as kind of reassurance that the the home care services have held up particularly well throughout the pandemic, and we've been calling and monitoring them every day, as well as providing support through PPE and the infection prevention control funding. But in terms of the staffing levels, at no point, even during the first wave of the pandemic, did they drop below 80% for people who had to be off for isolation or sickness reasons. So although we had made lots of preparations, there wasn't at any point a need to call in additional support or indeed redeploy any of our own staff to pick up work that might otherwise have been taken by home care agencies. So it's going well on the home care front at the moment. That's not to say that there isn't work to do with that sector in future, which was fragile in its underlying state before the pandemic.
Thank you, Gareth, for this clarification. But it will be you will provide us with like a brief summary report later on.
Happy to do so. Yes.
Thank you, Gareth. Any more questions from board members, councillors? Anyone want to ask leadership any questions on this update? No? I have one final question regarding the clarity of communication, especially on display, Councillor Kamali. Please, my observation, especially in marketplaces, open markets, is it possible, I mean, to have some form rather than just relying on, because the update, the information, we are becoming more reliant on some kind of media, but is it possible to have a visual media around the borough, especially in open market spaces? Have you discussed this with the communication team?
Yes, and I should say we have in fact had a digital display van driving around the borough, updating everybody on the rules and regulations. We are, of course, also going to be signposting to all of our testing hubs. And I do know that our community engagement teams are engaging with many of the residents associations and the VCSs, the charity sectors, to make sure that all the latest information can be shared. I do appreciate that the rules change quite frequently, and digital is obviously very quick, but we do need to make sure we're getting through people's front doors as well. And of course, you know, we rely on our community engagement teams to make sure that we're getting out there, as well as sort of visual medium through signs and these vans which are driving around the borough.
That's very encouraging, but I would like, I mean, to see like this to be investigated further, especially with the alongside the mobile digital communication. This will be a good to be explored and see the impact. If we can have, for example, some kind of survey associated with it. So hopefully this will have an impact on the test and trace, on where we are in terms of the dynamics in controlling this virus, because I can see now there is a mutant shift from the corona to another type of virus, which is setting alarm. So we need that communication dimension, and I'm sure you are already signaled that approach, which is quite appreciated. Anyone would like to ask any further clarification on the digital visual communication aspects? Councillor Chauhan.
Yes, sorry, my question wasn't on digital communication. So is it okay to ask a question on flu update?
Of course.
Thank you, Chair. So with regards to the national flu vaccination campaign, there's an ambition set by NHS England to have 100% of health and social care workers vaccinated by December 2020. This is the regular flu vaccination. Do we, just out of interest, do we have figures for our staff, our RBKC staff,
Thank you, Councillor Chown. I'm going to have to defer that. I'm assuming Natalia on that one.
Hi there. Yes, we do have that, and I can get it for you afterwards, Councillor Chauhan. Just to say, though, nationally, I think there's been a huge disappointment in the take-up of the flu vaccine across all ages, actually. And there's all sorts of work happening to understand vaccine hesitancy in total, because, of course, we are worried about how that will translate into COVID vaccine take-up as well. Lots and lots of work happening at national, regional and local level on that. But I can look at the figures and get that to you.
Useful to see how you compare with the wider kind of integrated health system.
Sure.
Thank you.
Just to say, we had on-site vaccines for staff. We had a really kind of rigorous approach this year.
Fantastic. Brilliant. Good to hear. Thank you.
Yeah, thank you, Natalie. That's excellent. I think at this point, I would like to thank lead member, Councillor Kamali, for joining us and answering our questions on the update of COVID. It is a very dynamic issue, and I'm sure, as you said, the situation changing not by the day, but by the hour, it seems like it. And as long as we stay on top of it, so we stay safe. And I thank Gareth and Natalia for joining us to answer our questions. Thank you.
Thank you, Chair. Thank you, everybody.
Thank you.
Thank you. Thank you, and a very good
Thank
evening.
you.
Thank you, Councillor.
Now I would like to move on to our A6 item on the agenda is the Select Committee Work Program Report. And if I call, this is our final agenda item on this evening. This report includes a summary of the topics prioritized and agreed at our the 22nd of October 2020 Select Committee meeting, and an update on the progress of the working group. The Select Committee is recommended to agree the progress made in the reviews. We have so far received reports on COVID-19 in social and social care and health at our October and December meetings. And we have just reviewed adult social safeguarding. Two of the topics, if I remind you, selected for review in our work program for this year is the mental health in North Kensington working group, and on the primary care single issue meeting preparation, which the first on mental health is being led by Councillor Williams, with membership of Councillor Atkinson and Councillor Idris, and on the primary care led by Councillor Thexter, with Christine Vigars as members. I will call if the Councillor Williams, if you'd like just to say something about the work you've been doing so far, and how do you see your position at the moment, and just give us a brief update, please.
Thank you, Chairman. We've had one meeting just to the group with officers, and also Councillor Atkinson and myself had an informal discussion with representatives of CNWL. The first step, and this is a formula that was being adopted by other working groups, certainly with in Family Services Committee, is to issue a call for evidence to the community. And this is, I hope, will happen early in the new year. We were hoping to do it before Christmas, but for various reasons that hasn't been possible. Arising from our discussion with CNWL, I came to the feeling, and I think I am supported by Councillors Atkinson and Idris in this, that the Appleby report into suicide in North Kensington, which was commissioned from Professor Louis Appleby by CNWL and published in September, that it's probably best if that is done by having a report to this select committee rather than just through the working group. And this needs to be a response not just from CNWL, but also, I believe, it's my view, from the councils as the public health authority and from the CCG, because many people with who have problems which might lead to attempted suicide do not come to the secondary health services. This is the national position. I don't think it's different here, but if they engage with any statutory services, it's likely to be the primary care with their GPs. So, I mean, I'm not going to preempt such a discussion, but as I said, I'd like this committee to agree that it will ask those three bodies to come forward jointly with a proposal to this committee, and then we can have a discussion, and interested members of the community perhaps could contribute as well.
Thank you, Councillor Williams. I think your position is clear. I'm sure a member of the committee will give you their feedback. Doesn't have to be discussed now. We can give you our feedback later. Or anyone would like to make any comments, members of the, or we can write, having heard Councillor Williams' position and ideas, I'm sure you will have our full support in terms of your positioning and how you want to move forward with this very important topic regarding the mental health in North Kensington. So thank you so much, Councillor Williams, for this update. Much appreciated. Can I call Councillor Thexter, please, just to give us a brief with Christine, if you like, so, or just yourself, no problem.
Thank you, Chair. Thank you, Chair. Me and Christine and officers, we had a meeting and we discussed the way forward onto our primary care service working group. And basically, we're going to discuss and we're going to go into depth in monitoring and evaluation services provided by primary care throughout the borough. And we're also going to look at their communication and engagement with patients in relation to these changes and also the health inequalities. We're going to be focusing and meeting with local residents, and we're going to particularly emphasize on geographic locations in the borough, both north and the south. For instance, the Guineas estate and the Wells End estate, and also other estates in the north of the borough. And we'll be dealing with various stakeholders such as the clinical directors of RBKC and the PCN, the voluntary sector, the CCG, and also CQC in order for us to reach our target goal.
Thank you, Councillor Thexter. Anyone would like to ask a question or just to explore? But this is a very clear and nice, still a work in progress, still in each initial stage. That primary care discussion will be a single issue meeting as been agreed before. And if we have any support we can give to the working group, it's really much appreciated. So please do contact the lead members who are leading on these two working group, and if anybody want to add to their capacity any ideas, it's much appreciated. Christine.
We just had a query about timing. It's, I think, essential that we get the clinical directors of the PCNs to come to this open meeting. And we just wondered what the situation would be with the rollout of the vaccine. So I think perhaps this is just something that we need to check with the West London CCG to see whether there's going to be capacity really to attend that meeting as we would wish in February, or whether that's going to be right in the middle of the next rollout of the vaccine.
Yeah, I agree with you, Christine. I mean, the situation changing almost daily, and the capacity, we don't expect everything to run by the clock here. So as long as we show agility and response, so yeah, I agree with you. So we can discuss that later regarding if we are going to reschedule. So that's, I'm sure the committee members will give you their full support there. Councillor Chauhan, I can see you. Do you want to come in for any observation?
Sorry, I think I had no. I did have a question, but it slipped my mind now.
No problem. We can regarding here the support of working group. We can, but I would really encourage any other members to join if you have capacity. Or if they need any specific help with a certain area, please do give them your support. If there is no more elaboration on this, I will open it to other councillors if they have any question that they would like to ask, or any comment, any observation. And any member of the public would like to comment? No? So I will close this item, and thank you so much, Councillor Williams and Councillor Sexter, for leading this important topics for us, and we look forward to your further progress. Thank you. Now I will move to the item, the third item on the agenda. That's the minutes of the meeting being held on the 22nd of October and the special meeting for Brompton on the 19th of November 2020. The minutes of the two previous meetings has been circulated, and full recording is accessible online. So hopefully any notes missing, I will appreciate to the amendments or by writing to the committee. But for the sake of this meeting, can I call on members of the committee? Is it your wish that they can be signed as a correct record? Councillor Spalding.
Chairman, yeah, just a quick clarification on page 3 of the October the 22nd minutes.
Okay.
It quotes me in brackets saying I took an opportunity to mention on a separate matter, but actually what I mentioned...
for us court.
No, not at all. It was under the discussion about COVID-19 recovery.
All right.
What I quoted was actually the council's guidance at that stage on COVID-19 risk assessments that staff and councillors should undertake before actually doing any visits. And so it was not a separate matter at all. It was directly related to COVID-19 work risk assessments.
Okay, Councillor Spalding, points made and correction will be made.
Yeah, thank you.
Okay, any other matter arising? Can I call for then? Can I sign them as a true record based on that amendment?
Agreed.
Can I call?
Agreed.
Agreed.
Thank you. Thank you, committee members. So that's signed. Bear with me 1 second, please. So may I now conclude this meeting of the Adult Social Care and Health Select Committee. May I thank all members, officers, and all the participants and those who attended this lively discussion. And I have no more to say except thank you again for your patience. And I'm glad the system did not let me down. So I wish you all a safe, a very good evening. Thank you.